For clonidine, one of our last antihypertensive medications. It's used last because it's very, very potent blood pressure lowering drug, given to lower blood pressure when the high blood pressure is persistent and not responsive to other medications. Since clonidine is very potent, we typically use other drugs to lower the blood pressure before choosing the supersized atomic bomb here. So the memory trick, clonidine, think cardiac down for clonidine. It decreases the blood pressure big time. Now caution, don't get tricked with sound-alike drug names. Clonidine is not famotidine and not clozapine. Just think clonidine, cardiac down. It starts with the C for cardiac and the D for down. Now famotidine is an H2 blocker for acid. It starts with F, so just think F for food for famotidine. And you take it before you go to dine with famotidine. And clozapine, just think clozapine. It's an antipsychotic medication that lowers the immune system. So we say zapine zaps white blood cells to lower the immune system. Now the mechanism of action is pretty simple. It works as an alpha-2 antagonist to decrease the sympathetic response from the CNS inside the brainstem to the peripheral vessels, resulting in decreased peripheral vascular resistance and vasodilation. Fancy words for it decreases the heart rate, cardiac output, and blood pressure. Now, as mentioned before, clonidine is a very potent antihypertensive. So it's given either patch or pill, like a really, really tiny pill. So the key point here and priority teaching is to not stop taking abruptly, or don't stop taking suddenly. Huge NCLEX tip. This is always the first priority since it's the most deadly here. It can result in severe rebound hypertension, leading to a hypertensive crisis, BP over 180 systolic, basically blood pressure so high that it can kill your patient via heart attack or stroke. So Hesse mentions clonidine, do not stop taking abruptly, and it selectively activates alpha-2 receptors in the CNS, as mentioned before. Number 2 is we slowly taper off over 2 to 4 days. And number 3, teach slow position changes. Remember, when the BP is low, we gotta go slow here. So any drug that lowers the blood pressure can lead to orthostatic hypotension. That low blood pressure that leads to dizziness upon standing, resulting in fainting and falls, especially after the first dose. So dizziness and drowsiness should diminish with time. And once again, the memory trick, if the BP is low, then we got to go slow. Now, some other common teaching about stuff to avoid while on clonidine. No other CNS depressants here, so no ATOH or alcohol, and no other sedatives which can lower the blood pressure further. And don't drive or operate heavy machinery, but this wasn't really tested on heavily. So Kaplan mentions a clonidine patch, we change the patch every 7 days. And Hesse mentions here, transdermal clonidine, we apply the patch to hairless, intact skin on the upper arm. And it's sometimes used to treat ADHD. But again, these 2 key points weren't tested on heavily, so I'd recommend focusing on the 3 key points as mentioned before. Alright, that wraps it up.